Okay.
All right, here we go.
Us here, I see. Good.
So hello, and thank you for joining us today. I'm Paulette McElwain, President and CEO of the Virginia League for Planned Parenthood and Chair of Planned Parenthood Advocates of Virginia. VLPP operates 3 health centers in Virginia, one in Richmond, one in Hampton, and one in Virginia Beach. Along with Planned Parenthood South Atlantic and Planned Parenthood Metro Washington, the 3 Virginia Planned Parenthood affiliates serve more than 22,000 women across our 5 health centers every year. We provide a number of services, including birth control, cancer screenings, annual exams, and abortion. Our dedicated staff, many of whom are here today, provide high-quality, compassionate health care every day. Women don't come to Planned Parenthood to make a political statement. They come for essential health care services, and we are committed to being here for them no matter what. Through a partnership with the Virginia Department of Health, VLPP provided STI screenings to more than 1,700 low-income patients for free last year. For many patients, Planned Parenthood is the only health care provider they see. Blocking them from coming to Planned Parenthood means there would be nowhere else for them to go. Once again this year, certain members of the Virginia General Assembly continued their political attacks on women's health, attempting to restrict access to basic health care services for the 22,000 Virginia residents who rely on Planned Parenthood services. To remind us all what's at stake, I am proud to introduce to you 3 Richmond women who will tell you their personal story of the life-saving benefits Planned Parenthood provides.
Hi, my name is Stacey Van Cherry. I'm the owner of Modelogic. We're a full-service talent agency, the largest one in the Mid-Atlantic region, and I've been in the city of Richmond for 24 years. But many years ago when I was in college, I was far away from home. I had no health insurance. I was broke, and I became very ill, didn't know what was wrong, and didn't know where to go. My friend took me to Planned Parenthood, where they took excellent care of me. They diagnosed me with a terrible bladder infection, moving into a kidney infection. They got me the medication that I needed, and they sent me home. Over the course of the weekend, they checked on me 3 times. They called me to see how I was doing. And the price of the service that day was $15. I did not need an abortion. I just needed simple health care that I could afford and get to. Without Planned Parenthood, I'm afraid that my nieces who are on their way to college this year won't have the same safety net that I had, and I want them to be able to have that as well as other women, of course, across the state of Virginia. I'd like to thank the governor today for looking out for women's health issues with his veto today, and appreciate everything he's doing for us. Thank you very much. Appreciate it.
Good morning. My name is Chelsea Wise, and I was born and raised in Virginia. I'm currently the program manager with Leaders for Life Incorporated, an organization that assists with Medicaid holders struggling to manage their independence because of mental health disorders. I'm also the assistant secretary of the NAACP, partnership lead with Creative Mornings Richmond, and a full-time mother to a 3-year-old princess. I was in graduate school at VCU working on my master's in social work when I first went to Planned Parenthood. They offered me compassionate care and were my best option for contraception at that time. I was using the birth control pill, and later, after I graduated, my husband and I decided to start a family, and we were blessed with my baby girl. After she was born, I went back to the birth control pill, but my body did not tolerate it. I tried 2 other options of oral contraception, but they affected my body and my mind. I literally thought I was going crazy. Luckily, the healthcare center I went to suggested the IUD, and it's been working perfectly for me since. I feel like I'm myself again, and I can be the mother that I want to be for my daughter and my family. It was important to me to have the healthcare provider that could offer a full range of contraception options available. Providers like Planned Parenthood are an essential part of the healthcare safety net, allowing young women like me to manage their reproductive health. Laws that undermine Planned Parenthood undermine the health of young women like me when I was in graduate school. I am thankful that Virginia has a governor who understands that and continues to support women by refusing to allow bills like HB2264 to become law. Thank you.
Hi, good morning. My name is Laura Quisenberry. I'm also from Richmond, Virginia. I currently reside in Henrico County. And I work with the Refugee Resettlement Group at my Catholic church, the Church of the Redeemer in Hanover. Through the program, I became a mentor of 2 young women who arrived in the U.S. a little over a year ago. and they were recently married. They came to America looking for a better life for themselves, and we were both concerned about their reproductive health. When I asked my own personal OBGYN about long-term reversible contraception, he suggested the Implanon implant. The cost at his office, $1,000. So instead, I took him where I knew where to go, Planned Parenthood. At Planned Parenthood, thanks to their sliding scale and subsidized birth control that they offer, we were able to get Implanon implants for $200 per young woman. Last month, on January 9th, I'm happy to report, both of these young women entered the 2-year ESL program at J. Sargent Reynolds Community College. They both have part-time jobs, and they just both got their driver's license. If it wasn't for the subsidized birth control, I am certain, and I know for sure, that instead of working to become strong, independent young women in America, they would be raising children for the next 20 years and would be completely dependent on their husband's limited income for years. When their child-rearing days were over, they would be at least 40 years old and they'd be starting from the bottom. They now have a shot at living the American dream, and Planned Parenthood has made that possible for them. Thanks so much.
Thank you, Laura. So these are the stories that I hear every day at VLPP. Stories from thousands of women whose health would be undermined if bills like HB 2264 went into effect. Fortunately, we are here today because we have a governor who has promised to be a brick wall to protect women's access to health care. Governor McAuliffe's highest priorities are to create jobs, grow the economy, keep our communities safe, and make life better for all Virginians. To do so, he has dedicated himself fully to making Virginia a more open and welcoming place for all. I am personally thankful that Virginia has someone in the governor's seat who respects the constitutional rights of women and has been our top ally in the fight for quality health care and access for all Virginian women. It's my great pleasure to introduce the Honorable Terry McAuliffe, the 72nd Governor of the Commonwealth of Virginia.
Thank you. Good morning, everybody. I want to thank Paulette for being here today, and Stacy and Chelsea and Laura for their stories. This is what matters to Virginia families today, and I thank you for being here with us today. I want to thank my wife of 28 years, the First Lady of the Commonwealth of Virginia, Dorothy McAuliffe, who has been at my side, and I want to thank our great Lieutenant Governor, Ralph Northam, and our great Attorney General, Mark Herring. This team has been a brick wall. I also want to thank the members of the General Assembly, folks. These folks have been stalwarts to protect women's rights here in the Commonwealth of Virginia, and I want to thank each and every one of you for your continued leadership. Let it be lost on no one why I am doing this veto in front of the governor's mansion today. Because this governor's mansion is the brick wall to protect women's rights here in the Commonwealth of Virginia. If you feel like it's Groundhog Day again, it is. We were together last year where I vetoed a very similar piece of legislation. We are here again today. Let me be very clear. We are here today because I am going to veto Senate Bill 2264. And I'm going to veto it for several reasons. I told the legislature during my State of the Commonwealth address, stop sending me socially divisive legislation that divides folks. We can only grow as a Commonwealth and compete on a global stage when we are open and welcoming to everyone. I have continually given that message, but they continue to send me legislation that will hurt Virginia and hurt Virginia's families. This veto today will be my 75th veto as governor of the Commonwealth of Virginia. I right now am 71-0, and I promise you I will be 75-0 by the time we finish up this legislative session, because we are working hard every single day to grow our economy. As Paulette has talked about, and the women who've heard their stories today, this is about providing women to adequate health care to provide for themselves on cancer screening, to deal with STD issues. It's important for women to have access to quality health care for their lives and for the lives of the Commonwealth. My Secretary of Health, Bill Hazel, and I, and Commissioner Levine, we work every single day to make sure that Virginia is providing the best health care that we can to each and every one of our citizens. That isn't just for men, it's for men and women. And it's time our legislature started understanding that we have to protect the rights and dignity of women of the Commonwealth of Virginia. So we will continue to fight. I see Catherine Waddell, who has been at my side from the start of this. We will continue. I thank Catherine and all of the advocates that were here today. But secondly, as Paulette has mentioned, I spend all my time on economic development. I believe I'm the most traveled governor in the United States of America, 22 trade missions to dozens of countries. You've heard me talk about the economic statistics, 185,100 new jobs. Capital investment, $5 billion more than any governor in the history of the Commonwealth of Virginia. Initial unemployment claims just hit a 40-year lowest since 1973. Our economy is strong. Why? Because we treat everybody with dignity and respect. We do not put walls up around our Commonwealth. If you want to understand the consequences of divisive, socially attacking legislation, just go to North Carolina and look at the price they are paying today for their socially divisive HB2 legislation. NCAA, ACC, Deutsche Bank, PayPal. We have CoStar here in the Commonwealth of Virginia, right here in Richmond, 732 high-paying jobs. They were supposed to go to North Carolina. North Carolina offered them 3 times the incentive package. They said, no, we won't go to that state because they discriminate. Discrimination breeds hatred, and we will not tolerate that here in the Commonwealth of Virginia. So let my message go strong here today that we will veto any legislation that harms any individuals. Virginia is a beacon of democracy that is open and welcoming to everyone, and let every employer around the globe know that if you want to come to America to do business, the best place to come is the Commonwealth of Virginia, because we treat everyone equally with dignity and respect. It's now my honor to introduce a man who has been at my side through every one of these battles that we have fought on equal rights for all. I've had to veto legislation, anti-women, anti-LGBT. We have been a team to make sure that we are strong. It's now my honor to introduce you the greatest lieutenant governor in the history of the Commonwealth of Virginia, our own Dr. Ralph Northam.
Good morning. It is great to see everybody here on such a beautiful morning. Governor McAuliffe and our First Lady Dorothy McAuliffe, thank you all so much for your wonderful leadership across this Commonwealth. Thank you all so much for your testimonials this morning. It is so important to hear about real life stories of what we're here fighting for in Virginia. And to my fellow legislators, thank you for standing with us. Thanks for being part of that brick wall to make sure that Virginia continues to be inclusive. I would like to also thank Planned Parenthood. I know NABRAL is here, other advocacy groups that fight every day for women's reproductive health care in Virginia. We thank you for your efforts and look forward to working with you as we move forward. As you all know, I am a physician. I take care of a lot of young ladies of child production age, and the only means of access that they have, many of them, is through Planned Parenthood. So the last thing that we need to do in the Commonwealth of Virginia is defund Planned Parenthood, and I am so glad today that Governor McAuliffe is going to take his pen and his ink and veto House Bill 2264. So thank you, Governor, for doing that today. Since I have been in the Senate and served as Lieutenant Governor of the Commonwealth of Virginia, I have watched and fought against legislation after legislation that interferes with women's access to reproductive health care, starting with the infamous transvaginal ultrasound bill, the personhood bill, the trap laws. None of these pieces of legislation are intended to make it safer for our women. They're intended to shame our women, and that's wrong here in the Commonwealth of Virginia. These are decisions that should be made between the women, their partners, and their providers. There is no excuse here in the Commonwealth of Virginia that legislators, most of whom are men, should be telling women what they should and shouldn't be doing with their bodies. It needs to stop. As the governor just said, we are very proud in Virginia that we're inclusive. Our lights are on, our doors are open. We welcome people to the Commonwealth of Virginia, and as long as you have folks like the governor, myself, and our Attorney General Mark Herring, and all of us working together, we will continue to be inclusive and be a welcoming state. That's what Virginia is all about. That's the Virginia way. So thank you all so much for being here today. Our fight continues. We do not stop today. And I want to introduce a friend. And when you talk about a brick wall, a man that has done courageous work across this great Commonwealth as our Attorney General, let's give it up for the greatest Attorney General in the land, Attorney General Mark Herring. Welcome, Mark.
Good morning, everyone. When Governor McAuliffe, Lieutenant Governor Northam, and I were on the campaign trail back in 2013, we promised to be a brick wall against attacks on women's health care and reproductive rights. And Governor, under your leadership, we have delivered. Health care is a reality only if it is accessible and affordable. And for millions of women across America and thousands of women in Virginia, Planned Parenthood provides essential health care services. And attacks on Planned Parenthood do nothing to advance health care. They take us in the wrong direction. They make health care less affordable and less accessible. We need to make it clear that we value and respect the ability of women to make their own decisions about their own bodies and health care. Now, I don't know what we're going to be seeing out of Washington in the months and weeks ahead when it comes to women's health care, or really on a whole lot of other things while I'm at it. But I can say this: I am proud to be a part of a leadership team that respects and protects the rights of women. Thank you all very much.
So, House Bill 2264 is about to go down. My message to the legislature: this wall just got taller and it just got wider, folks. Let's go do it.
Can I just yeah, thank you.
Thank you, Governor.
You bet. Here we go. All that?
Thank you.
Meg, where's all our Thank you. Thank you. Thank you very much. Appreciate it.